Look into a young child's eyes, and you can see the promise for the future. However, not every child has the early support and opportunities such as exposure to early literacy, consistent loving care, and quality early learning experience that together lay the foundation for a successful future. For 15 years, Durham's Partnership for Children has worked to create a comprehensive early childhood system that supports collaborative, innovative solutions for the needs of young children and their families to ensure more children have possibilities for a future filled with promise. Since 1995, Durham's Partnership for Children has been leading systemic change in early care and education, family support, and health with a sharp focus on strategies that have improved teacher education, created more access to high-quality childcare for low-income working families, enabled more evidence-based family support program models, improved family support programming, increased access to health care, and enhanced early intervention services.
The beauty of the partnership is that early on, when the first board of directors came together, they realized very quickly that there was no way that they could do this alone. And we knew that thousands of children needed childcare. We knew there was a need, and we knew we had to meet that need. We really have engaged a diverse group of stakeholders: the county, the city, the business community, childcare workers, nonprofit organizations, parents, the faith community, the medical community. It really is using the expertise to be able to help us so that collaboratively we can plan for the future.
The early childhood system has meant the transformation of children's lives. In 2003, the partnership recognized the importance of bringing the More at 4 program to our community and invested Smart Start matching dollars to ensure more Durham County 4-year-olds who were at risk were exposed to high-quality pre-kindergarten.
The More at 4 program has high-quality benchmarks, it has high-quality professional development requirements, and by raising the level of quality in our More at 4 program, we have been able to really see that ripple effect in all the classrooms in child care centers across Durham County.
By her being in the More at 4 program and being in that child care setting, I felt as though that gave her the jump start that she needed, and that without that program she wouldn't be so far beyond in her reading and her math at this time.
As More at 4 helps to expose 4-year-olds to the love of learning and discovering, the partnership has provided other tools to families to support their child's healthy development.
I think if we hadn't have had the Incredible Years program and we tried to do this like by ourselves, just working our way through this, it could have been disastrous, because the way that we were going was not exactly the best approach towards parenting, and with one of our children having special needs, and having the things that we've been able to get here have been able to allow us to put more energy towards some of the additional challenges that we have instead of just the basic parent issues.
The partnership has been supporting evidence-based family support models that help strengthen families with young children through home visiting educational programs, hospital visiting programs, literacy classes, parenting groups, and counseling. Knowing that most critical window of time when children are most likely to benefit from early intervention, the partnership has worked to enhance access and guidance for families navigating the early intervention system. Over the past 15 years, the partnership has worked to ensure children have preventative care, including timely immunizations, and gain access to consultation services.
Well, William was born at a little over 24 weeks. He was at 1 pound, 12 ounces. He was in the NICU for a little over 120 days. When he did come home, he had 11 medicines that he was on feedings for every 3 hours for a little over a year and a half. And was on oxygen for a year and a half.
Here we are, a family of parents with education and resources and health care, and still not sure how to navigate the educational environment from a standpoint of how do you have a child with some delays to be integrated in a mainstream environment, which is what we had been fighting for, and we didn't have anywhere else to turn. The partnership and Durham Inclusion Support Services has been a lifesaver. They've given my wife and I and William the attention and the encouragement that we needed when no one else would help us. It's made a huge difference in our lives, and it's made a huge difference in William's life.
While these services are critical for families like the Hannahs, the partnership has worked to engage different areas of the community to take a stakehold in our county's youngest children.
Well, the research has shown that by investing in the children early on, they go to school ready to learn. The dropout rate is lower. They have a higher tendency to move on to secondary education and college. They have a higher tendency to be employed and less dependent on the social service system. For every dollar invested in a young child, you get a $12 return on the back end, and the return has spoken for itself.
By engaging local businesses and working on collaborative events for the business community with the Greater Durham Chamber of Commerce and Durham Public Schools, the partnership has created more awareness around the critical connection between early care and education and lifelong learning success. This lays the talent pipeline for productive employees and a vibrant future economy.
We've come a long way, and yet there's still a long way to go. And my greatest hope would be that the role of the partnership grows enormously in the next 15 years so that we have more partners, more funding, more successes to talk about.
Knowing that school readiness is truly a collaborative effort involving families, schools, and the broader community, the partnership looks to the future with current strategic partnerships aimed at building support and increased capacity for young children and their families. Docs for Tots NC works to connect health professionals, primarily Duke University pediatric residents, with meaningful ways to support early childhood initiatives that influence the overall health of our young children. The Transition to Kindergarten initiative with Durham Public Schools incorporates strategies to ease the transition of preschool or home to kindergarten, helping to ensure more children arrive at school with the knowledge, skills, and physical and emotional health needed to successfully participate. The Early Head Start grant helps to build more early care and education and comprehensive support services for our county's neediest infants and toddlers and their families. This federal grant brings recovery funds to Durham that also creates new jobs in the community. The Early Childhood Faith Initiative is building awareness and stronger links with congregations to focus more efforts on children birth to age 5 and their families.
The need is growing, and so as the partnership looks to the future, it'll be our challenge to find new ways to raise funds from different sources, to support innovative, out-of-the-box programming. We are creating possibilities for every young child that attends a program that helps them to stay healthy, helps them to learn, and the more children we're able to touch, the more difference it will make in this community tomorrow, the day after tomorrow, and for the rest of our future.
When I grow up, I want to be a baseball player. When I grow up, I want to be a lifeguard. Don't you be a doctor. Grow up, I want to be an officer. When I grow up, I want to be a doctor.
Durham's Partnership for Children, creating possibilities for our young children's future.